And welcome to the weekly checkup presented by Wellstar Health Systems. I'm Belinda Skelton, filling in for Dr. Bruce Feinberg today. In the studio, our guest is Virtual Imaging, and we have Barry Petrie, the COO from Virtual Imaging, answering your questions. We'd love to hear from you at 404-872-0750. Welcome to the weekly checkup, Barry.
Thank you so much, Belinda. Always a pleasure to be in studio with you.
Yes, it's been a while.
Yeah, I missed you.
Yes. Okay. So for people who aren't familiar with virtual imaging, why don't you give us an overview about what you do and what virtual imaging is all about?
Sure. Virtual imaging is a veteran-owned business, and we've been serving the Atlanta area for about 15 years. We use low-dose CT scanners that are made by GE. And that low dose allows our members and our clients to come in and scan regularly, very safely, to look for things like cancer, heart disease, tumors, aneurysms, all those different anomalies. And, you know, the main thing that gets Americans, the number one killer of Americans, is heart disease. Mm-hmm. And so we're going to talk about that today. And just ironically, this February is American Heart Month. So
you just happen to be here on National Heart Health Month.
Exactly, and we've been super busy. A lot of folks who know that and have been coming in to talk to us to learn about if they're at risk and what's going on with their heart calcium score.
Well, and we want to kick it off and let you know that this hour we are giving away a free heart scan. Yes, giving away a free heart scan with complimentary with few minimum requirements, and that is until the end of the show.
Correct. And then, of course, we always welcome and encourage you to bring your spouse. So that free offer, that complimentary offer, is for you and your spouse or your partner. Typically, a walk-in price for that scan is about $400 or $500. So that's about $1,000 value for a couple.
That's tremendous. Yeah. And for you to acquire that, you need to call 770-678-SCAN. That's 770-678-SCAN for you and your loved one to get that free heart scan. And I think I saw in your note 700,000 people a year die of a heart attack.
Yeah, if you want to just dig into the statistics, it's pretty crazy. So,
I mean, that is chilling.
Yeah, one person dies every 33 seconds in America from heart disease. Yep, nearly 700,000 deaths each year are due to heart disease.
Every 33 seconds, someone dies of a heart attack.
So 1 out of every 5 deaths is the way you can look at that. It's by far the number one killer globally of folks. So, and really what we do is we allow people to come in and in a very quick, safe way find out if they're at risk for cardiovascular disease. And very simply, we're going to tell them if they have any calcification in their arterial pathways in their heart.
And it's so easy to do. Easy to do.
Yeah, we tell folks to budget an hour when they come in, and we can talk a little more about that experience. But the actual scan itself only takes about 5 or 10 minutes. The report comes back within a day or two. And what that report does is it gives you a total score of your calcium. So we want you to be 0. But that's not always the case.
Right.
Most of the time, the reports come back pretty good. My personal score was over 1,000 the first time I did it.
Barry.
And I wasn't expecting that. But not only do you get that net score, but you also get a score broken out by arterial pathway. There's 5 main arterial pathways. My case, that 1,000, of that 1,000, about 750 was in my LAD, the left anterior descending, which is also, as you know, is the
widowmaker, which is not good. That's not where you want it. So you don't want it anywhere, but that's really not where you want it.
Correct. And what we tell people is, it's obviously really important to get a baseline, not just of your heart scan, but for the other scans that we can talk about later. But really, that's the baseline. Really, what the most important test is the next one you're going to get, because it tells you where you are relative to where you were before, and you can start seeing trends in your health. So,
well, I'm coming Saturday for my scan, and I've been a 0, knock on wood, every scan I've had over the years, and I'll be honest with you, I'm nervous.
Don't be nervous. You're going to be fine.
No, I hope I'm still a 0.
Well, you've done some really great things in your personal health recently.
Yes,
I know.
I have.
I have a feeling that you're going to be very happy with your results.
I really have. I've worked very hard, so I hope I hope it shows up in the scan. Okay, folks, if you would like to join us, if you are wondering how the scan would work in your life, if you're a candidate, if you're claustrophobic, if you have questions about that, if you have heart disease in your family, maybe you've not been eating so well, if you're wondering if this is something you need to do because of those factors in your life, give us a call in the studio at 404-872-0750. That's 404-872-0750. So, Barry, we are a society of symptomatic medicine.
Correct.
We call
that medicine 2.0.
Medicine 2.0.
Yeah. We wait for a symptom and then we try to fix it.
Right, because we run and go, and then when a symptom happens, that's when we go see a medical profession.
Correct.
And then, but sometimes when a symptom presents itself, you've already got a major problem.
That's correct, and that's where we come in. And what we're a part of is what is coined by Dr. Peter Attia as Medicine 3.0. Medicine 3.0 is there's a couple pillars. One is living a healthy lifestyle, doing the right things to be from a prevention standpoint. Mm-hmm. But one of the key core foundations of Medicine 3.0 is also early and often screenings, okay? Because even if you do everything right, in my case, I never smoked. I ate right, I exercised, and I thought I would have a low calcium score, and here I am with 1,000 that then grew to over 1,500. So, yeah, I would have never known that if I hadn't screened.
Right.
Because
you're the picture of health. I would have looked at you and said, definitely going to score well, definitely going to be a 0.
It was a shock. And so that's why it's so important to screen and to not wait for symptoms. And, cancer is a whole nother thing we can talk about. If you're waiting till you get symptoms of some of that stuff, it can be, the outcomes can be devastating, right?
Right.
So, but let's just throw out a couple more since we're on this Heart Month, a couple other statistics. Over 800,000 Americans have a heart attack every year. Wow. And 600,000 of those are the first time they've had an event. But 200,000 of those are recurring events. Well over 120 million American adults in the U.S. have some form of cardiovascular disease. Mm-hmm. It is truly an epidemic.
Heart disease runs on my father's side of the family. His father had his first heart attack in his 50s. My dad had his first heart attack in his 50s. He subsequently had 4 heart attacks, quadruple bypass surgery, and passed away of a heart complication. So this is near and dear to me.
Absolutely. And we have folks that come in asymptomatic, and similar to my situation where they're surprised that they have a high calcium score, and then within a week later they're having a bypass surgery or they're having a stent placed. So that happens all the time. So and oftentimes the first symptoms can be death. So you definitely want to, I don't want to scare people, but you want to know, you want to get that first baseline, and that's where we come in. And and unfortunately, if you were to walk into your PCP or to the hospital and say, I just want to self-screen to see if they're gonna laugh at you, right?
Right. If you haven't had symptoms.
Correct. If you haven't had symptoms, right? So it's really what we're about. Our mission is to empower the individual to advocate for their own healthcare journey and maximize their health span. And we've talked about this before. You have 2 lives. You have your lifespan and you have your health span. Your lifespan is how long you live on Earth, mm-hmm. and your health span is how long you live on Earth the way you want to live. And that's really where we come in, right? Is empowering you to know what's going on in your health, not just cardiovascular disease, but cancer. We can scan the brain. We can do a lot of different studies that we can talk about later, but really empowering you and not waiting until you have symptoms or until you have a surprise.
I think I speak for a lot of people out there, Barry. Their health span, they want to live on this earth as healthy as possible, and as with it. They don't just want to add years to their life. They want it to be good, healthy years.
Absolutely. I mean, and the example I give is my own father. He is a great guy. He was the mayor of a little town near Savannah for many years and had a great life. And he lived to be 75 years old, and that's his lifespan. But his health really degraded in his late 60s, early 70s. So really, he didn't have a great quality of life for the last 5 or 6 or maybe even 7 years of his life. So that was his health span, right? And so our goal is to really empower people to reduce the difference between those two lifespans, between the lifespan and the health span, and
right.
Really, finding things early and being intelligent about your healthcare journey is really what it's all about.
And you have to be your own advocate in your health.
100%. 100%.
Nobody's going to fight more for your health than you.
That is 100% true. And, I hear people all the time that will come in and they'll say, "Hey, Barry, why did my doctor tell me to do this?" And that's a real complex answer. But, the easiest answer, a lot of times doctors don't realize that there is such thing as a low-dose CT scan. So they're immediately putting their hands up and going, "Wait a minute, there might be an issue with too much radiation." That does not impact us here because we're at less than a quarter of the dosage of a normal CT scan. So it's very safe, it's very effective, and you can do it regularly.
And we want you to do it and call this number for a free heart scan for you and a loved one. Minimum requirements. Call by the end of the show today, 5 o'clock, 770-678-SCAN, 770-678-SCAN. This is a complimentary heart scan. I mean, it doesn't get any easier, folks. 770-678-SCAN. You're listening to the Weekly Checkup with Virtual Imaging as our guest in the studio, only on 95.5 WSB. And that was Every Heartbeat by Amy Grant. Send us the songs that you'd like to hear, and we'll start playing them next week. We're back on the Weekly Checkup, presented by Wellstar Health Systems. I'm Belinda Skelton. Our show is produced by Lens, Atlanta's healthcare marketing experts. Today's guest is Barry Petrie, COO from Virtual Imaging. We're taking your calls in the studio, folks, at 404-872-0750. And don't forget, we're giving away a free most important thing, if you get anything today, we're giving away a free heart scan.
Correct.
At 770-678-SCAN. That's 770-678-SCAN. Between now and the end of the show, which is 5 o'clock, I want you to get this. It's so vitally important. February is Heart Health Month, so take advantage of this. If you do nothing else today, this is the most important thing. Write this number down, 770-678-SCAN. Call between now and 5 o'clock. I know it's going to be very busy. If you get a message, just leave your number and they will get back to you. So, Barry, I want to discuss what you can expect when you come to Virtual Imaging. You call that number and
Correct.
You sign up for the free heart scan. What's going to happen?
Yeah, and just to follow up on what you said, please, if you're calling in right now, we do have folks standing by, but during these shows the call volume goes way up, so feel free to leave a message. You can also go to virtualimagingatl.com and do a form submission there, and someone will get back to you shortly. And so please be patient and be persistent. We want to help everybody who's listening. But here's the way this works. When you call in, you're going to talk to one of our telephone support folks. They're going to ask you a few qualifying questions, and then you're going to come in. When you sit down, you're going to sit down with one of our consultants, and that is a really very comfortable, laid-back, educational 45 minutes to an hour where you're learning not just about how we can uncover and detect heart disease, but our other scans that allow you to look for other issues in your life like cancer, aneurysms, dementia, all those things. So you're going to learn about all these different things that are available to our members. And our members, And that's our business. We have a membership model, so folks can come in who join the program, and they can come in every year and scan. Again, the most important scan is the next one, because we want to see how we're changing over time.
To see what's changed.
Exactly. And if just because I don't have a spot in my lung this year doesn't mean I'm not going to have one next year. So that whole experience from start to beginning, it's about an hour. I tell people to budget an hour, but the actual scan itself, and at the end of that conversation, you're going to say, "Hey, thanks so much. Let's get my heart scan," or you're going to say, "Wow, this is really an amazing value that I want to take advantage of, and I want to advocate for my own health." And then that full body option will. So there's a couple options. You can do what I call a core body, which is your neck to pelvis scan. So that's
is what I'm doing next Saturday.
And we're going to scan your head as well. That's the full body.
Yes.
So the full body includes that head scan. So our members who come in and under that full body program, they annually get their calcium score. That comes pretty quick, within a day or two. Then the rest of those images goes out to my radiology team. And so those reports take about 3 to 5 days. And so you'll get 2 additional reports. You will get a report in about 3 to 5 days that goes through the head. So we're looking for aneurysms, we're looking for tumors, it does a white matter, gray matter analysis for dementia predictability. Of course, we can see bone infections or sinus infections. That's a 1-page report. Then you'll get another 2-page report, which is that core body. So we're going through everything from the thyroid down to the pelvis. So all those major organs in between.
Oh, it's amazing, the information you get from these scans. And please take us up on this free heart scan offer, 770-678-SCAN. You're listening to the Weekly Checkup only on 95.5 WSB. And welcome back to the Weekly Checkup presented by Wellstar Health Solutions. I'm Belinda Skelton, and we're joined in the studio by Barry Petrie from Virtual Imaging. We're taking your calls in the studio, folks, at 404-872-0750. And don't forget, we have on the table a free heart scan for you and a loved one. Minimum requirements, 770-678-SCAN. That's 770-678-SCAN. And Barry, what did you say was the value for the free heart scan?
$4.99. So we have folks that walk in all the time, and they'll pay the $4.99 for the heart scan. And if you were to go to a traditional hospital facility, it could be as high as $1,000.
Yeah, and we're offering this to you today. Complimentary, 770-678-SCAN. You got to call by the end of the show, which is 5 o'clock today. And if you get a busy signal, please just leave your information and they will call you back. Now, Barry, what I love are when we have testimonials on the air, because it really drives home what you're doing at Virtual Imaging and how important it is.
It does. And I will tell you, I have a catalog of all those testimonials you guys have done for us over the years.
Oh, great.
And it is inspiring to me to listen to those. It really gives me a reason to get out of bed every morning.
Oh, and it happens every day at Virtual Imaging. And we have one on the line here. We have Larry. Larry, you're on WSB. How are you today?
Hey, Belinda, thank you so much for getting me on the program. I'm really glad I happened to tune in this afternoon. I am familiar with virtual imaging. I first found out about virtual imaging back in 2010, and I thought it was interesting, but it's not the kind of thing that I would ever need. And in fact, it wasn't until 2011 that I actually came in and got a heart scan.
Okay.
Now, I say it's the kind of thing I didn't need because I felt healthy. I felt great. But that wasn't the real reason. The real reason was I was afraid to come in.
Oh, okay.
I have heart disease in our family. You mentioned it earlier on the program. Our family history is every bit as bad as yours. Mm-hmm. Every aunt, uncle, parents, whatever. It's been heart disease, and and they're all gone. All those people have left us.
I'm sorry.
That was the real reason I procrastinated for almost a year. And when I got into the machine, that was my primary thought. Now, the amazing thing is when I got the radiology report, it was just the opposite. I had a score. There was some calcium. I'm not that young a person. I'm 75 years old. I was a lot younger, though, in 2011.
Right.
But anyway, I had a 300 score. I mentioned I heard you say you had a 0.
Right.
And I think the gentleman there with you, Barry, he had a bit higher score.
Mm-hmm.
But I thought for my family, this is like a miracle.
Mm-hmm.
And what it created for me, above all else, was incredible peace of mind.
Yes.
Now, because there have been some other issues in our family over the years, my sister at 48 years and 8 months did pass away from pancreatic cancer, which surprised us all. So when they talked about you really do need to do this on a routine basis, that's the choice I made. And I've been coming in every year, and every year that 300 score has stayed about the same, which has been very reassuring, I might add. But in 2019, when I came in, everything changed. And I don't know why. I'm not one of these people that had symptoms. In fact, if anything, I've gone the other way. I was hiking and walking on a very routine basis. I would say over 100 miles a month.
Wow.
And felt great. And then I had this score that really scared me. Of course, I went to a cardiologist. I did get 2 stents. One was in the right coronary, and the other was in the artery that's behind the heart, the circumflex. And what was crazy about it, to me, it was so easy. Once I knew, once I got in, today's science and technology that these guys have at these hospitals, it was nothing like when my dad went in.
Oh, absolutely.
And had heart surgery. And in fact, I was back hiking within 2 weeks.
Oh, that's tremendous, Larry.
Yeah, it really is. And I don't know if there's anybody out there like me, but this is not something to procrastinate about. This, and especially with this offer that Barry's put on the table, I would say that with all sincerity, if I hadn't done this, I wouldn't be on the phone with you all this afternoon.
Wow.
That's a big statement. Thank you so much, Larry, for calling in. I appreciate you taking the time to share your story.
Thank you so much.
Thank you, Larry, and have a great day, okay?
Thank you for letting me visit with you.
Absolutely. Take care. That story really resonates, and him saying that he would not be here.
Yeah.
If he had not gone to virtual imaging. I mean, how does that make you feel?
Well, like I said, it makes my hair stand up, and it makes me emotional, and it makes me proud. And I was in corporate America my whole life before joining the team back in 23, and to say that we are saving lives is not hyperbole. It is not. It is not an overstatement. And the stories happen. It's not every once in a while. It is regularly. It's not every day. It's not just heart disease. It's ovarian cancer. It's lung cancer. I can tell you, we have, and Dr. Jason Budd, who's a very well known cancer surgeon, and we've had him on the show. He reached out to me a couple weeks ago and said, Barry, I've saved at least a dozen people's lives because of virtual imaging in the last year.
And this is in our back door.
Yep.
You don't have to travel to another state to get this test.
You do not. And we're really, if you want to self-advocate and you want to take control of your healthcare journey and you want to do these things, we're really the only option in Atlanta. And so, please pick up the phone. Please dial 770-678-SCAN and make that call. And know that when you come to see us, you're going to be treated well. You're going to be treated with respect.
Yes.
And by the way, my name is Barry Petrie. If you come into my office and you have any other experience, you can call me personally.
Right.
And I will be more than happy to make sure that you are happy.
Yes, he certainly will. Absolutely. And Barry, it is so nice that people are taking us up on this offer. I love hearing on Monday morning, you'll call me and say, Belinda, 400 people called.
Yeah.
And took us up on this free offer. Well, that's 400 lives that are possibly changed.
And you think about it, it's not just that person, but you think about the network of people around them that care and love for them.
Yes.
And really that's what we see a lot of times. People come in, the guys will come in because their wives made them come in, not because they want to come in. Oh, yes. Right? And so we definitely encourage you to advocate not just for yourself, but advocate for your loved ones.
Now, Barry, let me ask you, if you have high cholesterol, does that translate into high calcium?
It can. Everyone's different. Everyone's chemistry is different. You can have, I'll give you, again, I'll use myself as an example. I'm 55 now. Ever since I was 40, my cholesterol levels have been perfect. And so I did not have that precursor. And yet here I am with a 1,000 score in my LAD.
Okay.
So, but high cholesterol is definitely one of those risk factors. High blood pressure is a risk factor. Poor diet, lack of exercise, high stress levels. These are all risk factors. And there's racial disparities. There's unfortunately Black Americans have the highest risk of heart disease and stroke. So there's a lot of things you can do. You always want to try to remove as many things off the table as possible. So you want to have your cholesterol down. You want to be in a healthy weight. You want to exercise. You want to try to get your heart rate up 30 minutes a day. But even if you do all those things, there's still, there's that genetic component, right?
Right. That you can't change.
Yeah. And I will tell you, it goes the opposite way too. I see people sit across the desk from me that they look unhealthy. They are overweight. They smoked 30 years and, they got 0 calcium scores. And it's just,
you can't predict.
It goes both ways. It absolutely goes both ways.
You can't judge a book by the cover.
You cannot. You absolutely cannot.
So that's why we want you to take us up on this great offer of a free heart scan for you and a loved one at 770-678-SCAN. That's 770-678-SCAN. And you can have peace of mind, or you can get the knowledge that you need to start changing whatever is going on.
Yeah, and it's never too late to make changes. It's certainly never too late to find out what's going on. And I do have people who will say, look, I'm scared. I don't want to get scanned.
Well, you heard Larry say he was scared.
Yep. And that's what made me think of it. And I will, and of course, I'm going to plagiarize somebody. This isn't my original content. But, what I tell people is if you're going to cross the street, outside our door here at the station across Peach Street, which is a busy 5-lane road, would you look both ways before you go?
Absolutely.
Yeah. And really
3 times.
So that that's really the idea here is, don't you want to know what's coming at you,
right?
Or what's what your risk is, and so because that's what you're doing, you look both ways. You're minimizing your risk, and so this is part of that. So again, the foundations of Medicine 3.0 are healthy lifestyle, prevention, and then early and often screening to make sure we catch things early.
And catching things early gives you choices in your health care.
Yep.
And that changes everything.
Absolutely.
And that's what we're here to do today. And you can do that by calling 770-678-SCAN. That's 770-678-SCAN. We're going to take a break. We'll be back. You're listening to the Weekly Checkup only on 95.5 WSB. And welcome back to the Weekly Checkup. I'm your host, Belinda Skelton. Today's guest is Virtual Imaging, and I have Barry Petrie, the COO, in the studio. And our show is presented by Wellstar Health System. At Wellstar, the patient is the center of everything they do. Wellstar is nationally ranked and locally recognized for its high-quality care, inclusive culture, exceptional doctors and care caregivers and one of the largest and most integrative healthcare systems in Georgia. Thank you so much for tuning in, and we're taking your calls at 872-0750. And we have about 7 minutes till the top of the hour, but I want to remind you that we are giving away a free heart scan at Virtual Imaging at 770-678-SCAN, and that is until 5 o'clock. So get dialing, folks. 770-678-SCAN. A free heart scan will show your calcification. What else does it show, Barry?
That's what it's going to show. That heart scan will give you a couple of different data points. It's going to tell you your total calcium score. It's also going to tell you where you are demographically. So it's going to give you a reference to where you are relative to other folks, your age, sex, and race. So in my case, when I did my first scan, I found out that 90% of people in my age, sex, and race would have a score lower than me. So that was not good.
Not good.
So.
Okay, why do we get asked this all the time? Why does my doctor not recommend that I go to virtual imaging?
Yeah, there's a lot of misinformation out there. A lot of, and the main thing is most doctors don't even know that GE makes a low dose CT scanner, so they don't know there is such a thing as a low dose. So they'll tell their patients oftentimes, don't do that. It's too much radiation. That is an absolute untruth,
right,
relative to what we do. Now, granted, if you go into a hospital CT, you should not be scanning on those machines once a year. Matter of fact, the AMA says no more than 4 or 5 of those in a lifetime, right?
Oh,
yeah. But in our scanners, our members can safely scan once a year with no issues. The other thing is, and this is just, some people are going to probably not like the way this sounds, but unfortunately, our system, the American medical system, is bought and paid for by big for-profit insurance companies.
Absolutely.
Period. And you know what? With rare exception, the way that our healthcare works is they mandate that there's no screening unless, with a few rare exceptions, unless you have a symptom, right? So unfortunately, if we're waiting until we have a symptom before we're screening, our health outcome can be really bleak. Okay, it can be a long, drawn out recovery, or it could be worse. So it's just our system is just not set up to allow people to self-advocate, and a lot of times if it's not your doctor's idea, it's not a good idea, and that's just
right.
Unfortunately, that's not the way I approach my personal health. I feel like I'm the best advocate for my health, and I want to know about things before it's too late, and so that's the bottom line. Is this is why we're here, so allow people to be those self-advocates for their own health care.
Well, we do preventive care for breast screening.
We do.
We do preventive care for teeth.
Yep.
We do preventive care for eyes.
Yep.
Why can't we do preventive care for heart?
Well, and think about this. Lung cancer is the number one cancer killer. Number one. And unless you have a history of smoking, your insurance won't pay for a lung screen.
This is ridiculous, Barry.
And that, and of course, every state's a little different, but here in Georgia, and 20% of all deaths for lung cancer, they never smoked. So think about that. That's really telling right there. So we want to give everybody the opportunity to come in and screen for all these things, and that's why we're here.
Absolutely. Please call 770-678-SCAN for your free heart scan. You're listening to the Weekly Checkup only on 95.5 WSB. And welcome back to the Weekly Checkup presented by Wellstar Health Systems. I'm Belinda Skelton. Our guest this show is Virtual Imaging. And in the studio, we have Barry Petrie, COO at Virtual Imaging. And I want to remind you, we have just upped our offer this hour. A free heart and lung scan at 770-678-SCAN. That's 770-678-SCAN. So if you called in last hour for our free heart scan, we will honor and give you the free heart and lung scan. Is that correct, Barry?
That's correct. Anybody calling today will get automatically entered into that offer as well.
I mean, that's tremendous. A free heart and lung scan.
Yeah, it is. And just to tell the audience, so the calcium score is primarily done by the machine. We have a technician who will tabulate those results and then put that in a report. But all the rest of the imaging goes to radiologists. So we're talking about now offering a study that's going to be a professionally prepared medical document by a radiologist.
Okay, let's talk a little bit about a lung scan now and the lungs and how lung cancer is detected. And if I remember from a past show, if you have a symptom of lung cancer, it is way advanced stage.
It could be advanced. Yeah, exactly. And so the answer to your question, so what we're talking about, just to put it in real basic terms, we're offering as a free chest CT.
Okay.
So in the chest CT, when we say heart and lung, that's a chest CT. So you're going to get that calcium score, but then 3 to 5 days later, you're going to get the chest CT report, and that's going to give you assessment of your lungs. So we're going to see if there's any nodules in there. We're going to see if it's clear. We're also going to tell you if you have any thoracic aneurysms. Okay, so my grandfather died of an aortic aneurysm.
Oh.
My dad had one that was repaired at Wellstar. And so sometimes we'll get imaging farther down to the abdomen. Just depends on, a lot of different variables, size of the person, how they're on the table. But we may get some liver information as well. But that again is going to tell folks what they have going in their lungs. Now, cardiovascular disease, number 1 killer of Americans. Cancer is number 2. Within cancer, lung disease is the number 1 killer. And again, as we said earlier, 20% of those folks who succumb to lung cancer never smoked ever. Okay. And, a lot of people will come to me and I will ask the question, what's the difference between a stage 1 diagnosis and a stage 3 or stage 4 diagnosis? Let's just take lung cancer as the example. It's real easy for you to say, well, I may survive a stage 1 diagnosis, but I may pass away to a 3 or 4 diagnosis, and that's true. But really, it's a much more complex answer. What if you get that 3 or 4 diagnosis and you survive? Man, your life has changed. You've gone through a traumatic experience.
Yes.
You've probably lost functionality. You've lost months, if not years, from your work. Your loved ones have been affected by this. My cousin and my college roommate and my fraternity brother went through a long stage 4 cancer battle that he survived. But he will tell you, he would say to you, I don't know if I would do it again if I knew what I was going to go through.
Really?
Yeah, 100%. And the other variable, 66%, so almost 70% of all bankruptcies in the U.S. are directly related to medical, to these long, drawn-out, expensive medical. So it's not just
devastating.
It's not just simple
financially.
Absolutely, it's not just a simple life or death. I mean, it's a much bigger question. And what you're really talking about here is an insurance policy against those things, against those long, drawn-out medical battles, against those long, drawn-out medical bills, and life or death in some cases.
And you can help. Not prevent, but you can help your side of the coin by calling 770-678-SCAN. That's 770-678-SCAN, because this hour we're giving away a free heart and lung scan. Barry, what would that value be on that?
That'd be about $1,500 per person. So if a married couple comes in, it's about a $3,000 value. Absolutely. Yeah.
Tremendous.
Yep.
Thank you.
Yeah, no, my pleasure. Hearing Larry calling earlier and my folks on the phone have been texting me, telling me how many folks are calling and asking about the lungs. So we decided we're responding to those folks and we're here. We hear you guys. We know what you want, and we want to give everybody, we want to try to help everybody that's listening today. And
that's what I love about virtual imaging, that you care about the patient.
100%. If it weren't for this community, we wouldn't be here. We've been a partner with WSB for going on probably 15 years now.
Yes.
A lot of that goes back to Neil Bortz and Royal and you. And I will tell you, we do this. We're a for-profit company. We're not a a public health department, but we do it because we're saving lives. And at least once a week or twice a week, I'll have somebody come in and say, I got to tell you, you saved my life, or you saved my husband's life, and I want to tell you the story. And I love
amazing. Being a part of that. I know it makes your day. It certainly gives me chills every time we have a story.
It's funny. My previous career, we in corporate America, we would say, hey, don't take ourselves too serious. We're not saving lives here. but
You
now
are.
we are saving lives.
Absolutely.
So it really is. It really is. Feels fantastic. I love going out with family and friends because I'm always the person they want to talk to and tell me what we're doing, and it really makes me feel fantastic. Be able to spread the word.
Well, let's go over. We talked about this last hour, but it's worth repeating. Your lifespan versus your health span.
Yeah. So our mission statement is to empower the individual to advocate for their own healthcare. For their own healthcare journey and to maximize their health span. And this is not a phrase that I coined. This is a phrase that Dr. Peter Attia, who's a real famous functional medicine specialist and cancer specialist, he says you have two lifespans, or you have two lives. You have a lifespan and you have a health span. Livespan is how many years you lived on Earth, and health span is how many years you lived on Earth the way you wanted to live your life.
Yeah.
And so, part of living a healthy lifestyle and doing all the right things, also screening and knowing what's going on in your body is another part of maximizing that health span. And really, our goal is to empower folks who can listen to us today and who come into the Atlanta facilities to really minimize the difference, the delta between their lifespan and the health span. We want you to live. We want your health span to be the same as your lifespan, right? We want you to live to the last day of your life, the kind of life that you want to live.
We all know those people who are just existing. And then we know those people who are maximizing their days, like my Aunt Pat, who's 93 and living life to the fullest.
Yeah, and you can just, and everyone has these stories. I mean, you can go to an assisted living facility and see some of the sadness. But my grandfather was 89 years old, my great-grandfather, and I was already in my career, and he drove himself to the store every day. He could tell you everything about the Braves, all the statistics. And
love it.
When he was 89, he went to bed and didn't wake up. And that was his.
If we all could be that lucky.
His health span exactly was as long as his lifespan. It was really so awesome. And then, unfortunately, my father was, it was one of those stories where, those two lifespans, the lifespan and the health span were, about 5 or 6 years difference. And so I saw that, and it wasn't pretty.
And we have a little control over that and how we handle our health care and being proactive in our own health care. And you can do that by today calling 770-678-SCAN and taking advantage of that free heart and lung scan.
Yeah, we're doing, and again, I want to remind everybody, we're doing this mainly because it's American Heart Month. So the most important thing that you need to do is get that heart screened, because that's the number one killer. And just to throw out some of those key statistics again, Belinda, one person dies every 33 seconds from cardiovascular disease.
That statistic just chills me every time you say it.
Yep, almost 700,000 deaths each year in the U.S. alone, and that equates to about 1 in every 5 deaths, unfortunately, in this country are due to cardiovascular disease. And so, over 120 million adults in the U.S. have some form of cardiovascular disease. Unfortunately, I'm one of those people. Again, the best thing you can do is to get screened to see if you're at risk, and then once you come back and you get either a clean bill of health or you have something, we can help you either way, right? If you come in with a 0 like you've done, we want you to come back to make sure you're staying in that safe range. If you do have a score that's concerning, we can put you with some fantastic practitioners who we partner with who absolutely will listen to you and we'll go down a diagnostic pathway with you.
And I have a family history of heart disease. My precious daddy had his first heart attack in his 50s. Yep. And he had 4 more in his lifetime and a quadruple bypass surgery, and passed away a year ago of a cardiovascular event.
Wow. And
so to say it devastated my family is an understatement.
I know.
So it's very near and dear to my heart.
Thank you for sharing that with us, Belinda.
So please call 770-678-SCAN. Sorry, folks.
Belinda, I will just tell you, you inspire us. Your positive attitude and your energy that you give us at Virtual Imaging, it means so much. And I'm so happy to be able to spend time with you in the studio. So thank you so much.
Well, my goal is to take that number from 33 every 33 seconds to a much higher number than that. So we're going to take a break. You're listening to the Weekly Checkup only on 95.5 WSB.
Are you with me, Dr. Wu? Are you really just a shadow of the man that I once knew?
And welcome to the Weekly Checkup presented by Wellstar Health Systems. I'm Belinda Skelton. Our guest in the studio is Virtual Imaging. And we also have Barry Petrie in the studio, COO at Virtual Imaging. And our show is produced by Lens, Atlanta's healthcare marketing experts. We'd love for you to join the conversation in the studio by calling 404-872-0750. If you have questions, if you're a candidate for the EBT scan from Virtual Imaging, maybe you've been eating a little too much fast food, or maybe you have genetics that aren't on your side when it comes to heart disease. Give us a call at 404-872-0750. So Barry, let's talk about what happens to you when you call 770-678-SCAN and you take us up on the free heart and lung scan. What's going to happen when you come into Virtual Imaging?
Well, when you make the phone call to 770-678-SCAN, hopefully Lee or one of her team members are going to pick up the phone, and they're going to get some information from you and get you on the schedule. And then when you come in, I tell people to budget an hour. And during that hour, you're going to learn about all the different scans we offer, including the heart scan. So what we have beside the heart scan is we can do a core body CT, that's neck to pelvis. We can do a head brain scan, obviously that's self-explanatory. We could do bone density studies. We can do visceral fat studies. Visceral fat is the amount of fat that's around your organs.
I'm scared of that.
No, you're doing a great job losing weight. So
I
think you're getting going in the right direction there. And then in that visceral fat, the higher the visceral fat content, the higher risk you are for cardiovascular disease, cancer, type 2 diabetes. So you always want to know if a lot of people will do a BMI, doing some simple calculations. That's really worthless. Because there's so many different body types. The visceral fat study will tell you exactly if you're in a healthy body fat range, and then liver study. So if we see the presence of liver fat infusion in your liver when we're doing that core body scan, we can go in and do a much more in-depth graphical report that tells you exactly to what extent that infusion of fat is in the liver, and that could be a precursor to liver cancer, a liver disease, which is can be very deadly.
Okay, so did you mention fatty liver in that?
Yeah, I did. So
okay.
Yep.
Can you reverse a fatty liver?
You can absolutely reverse fatty liver by diet and exercise. So a lot of times people will confuse fatty liver with liver disease. Okay, liver fat can be a precursor to liver disease. There's 4 levels of liver disease, stage 1 through 4. Everything up to stage 3 is reversible. Obviously, the higher up that scale, the more difficult it is. But once you get to stage 4, which is also cirrhosis, that's irreversible. So you either get a new liver or you perish. So the problem with the liver is that a lot of people have liver disease, they don't know it, and then one day they look and they got jaundice and they go in and it's hard. It is hard, even if you're at stage 3, it's hard to reverse that without a lot of work and a significant change in your lifestyle. But liver fat is a really good way of understanding your liver health, and that can always be a lot of these things we do, you want to correlate them back to annual blood work.
Okay.
Yep.
All right, great. All right, it's 27 minutes after 4 o'clock, 46 degrees. We're going to take a break. You're listening to you're listening to the Weekly Checkup, only on 95.5 WSB.
I don't need no doctor, 'cause I know what's ailing me. I don't need no doctor, no, 'cause I know what's ailing me. If you wanna feel real nice, just dance around.
And this is the Weekly Checkup, and I'm Belinda Skelton, and our guest in the studio is Virtual Imaging with Barry Petrie, the COO of Virtual Imaging. Our show is presented by Wellstar Health System, the largest and most integrated healthcare system in Georgia, and sponsored by the Georgia Trauma Foundation, investing in trauma care to save lives. Olansky Dermatology and Aesthetics, offering the highest quality in medical, surgical, and cosmetic dermatology. Avant Gynecology, Atlanta's GYN and surgical specialist. Virtual Imaging, EBT screening for cancer and cardiovascular disease. You can join the conversation, folks, in the studio by calling 404-872-0750. And we got a call that couldn't hold on from Blaze. And she said she first heard about virtual imaging the week that Royal died. And she was cleaning out her mother's attic and had the radio on and heard about virtual imaging. And when she got some money from her mother's estate, came back to Atlanta, and the first thing she did was march herself to virtual imaging and bought the membership,
Right.
and has been scanning the full body scan ever since.
Wonderful. Yeah, we've I will tell you, we have scanned last year alone. We scanned about 6,000 people just last year in
Wow.
2024. So historically, we've scanned probably somewhere north of 150,000 scans.
Mm-hmm.
So it's so great to hear those folks that have been
Yes.
coming year in
Love
in
it.
year out, and you know, when they refer us to a family or friend, there's no better compliment than when that happens. So really appreciate it. And those stories, you know, we've had a number of folks who've come in here and done testimonials, and one that really sticks out in my mind, and I have a personal relationship now with this lady, is she was a nurse, and she was having some symptoms. She was in her late 30s. Her name's Melissa, and she came in. She had gone to see her doctor for some symptoms, and really the doctor just assumed that she was maybe going through premenopause.
Yeah.
And so said, you know, premenopause, here's what you want to do. But
Well, she seemed a little young for that.
yeah, she did. And she just had that intuition, you know, that she felt like there was something more to it than that. So she came into us. She came into Virtual Imaging, we scanned, and we did find something in her ovary that was cancer, and that was overlooked by her doctor, by her PCP. And she went through the mediation. She had, you know, the surgery. She had the chemo. She recently went back to MC Anderson for a follow up, and so she's doing great. And that's an example
great.
of somebody who she would have slipped through the cracks if she had just
Yes.
listened to her doctor. And then my other favorite story is a gentleman. He came all the way from South Georgia. He came from Thomasville. He'd heard about us when he was driving to his hunting land, and while he was hunting that week, he had some symptoms when he exerted himself, and it really scared him. He had not experienced that before, so it just happened to be coincidental that he heard our ad. He called us. He drove up all the way, you know, 2 or 3 hours from Thomasville, Georgia, with his wife, and as he was walking out the door, he gave him a card and said, "Hey, if you have any questions, give me a call." Called me that night, texted me that night at 9:30, and said, "Hey, I've got a score of well over 1,000,
Wow.
and I'm a little concerned." And I said, "Well, let me ask you a question." I said, "Are you having symptoms now?" He said, "You know what?" And that's when he told me about the hunting
Yeah.
situation. I said, "I would tell you, if you were my brother, go to the hospital. You're having symptoms. You got a high score." His wife called me from his line the next morning. He was actually in the Thomasville hospital waiting for a bed in Tallahassee to have a triple bypass. Wow. Yeah, and again, you know, that was he came in one day, and the next day he was actually in the hospital and ended up getting that bypass surgery in Tallahassee. So the stories go on and on.
We could fill the rest of the show.
People, yeah.
With these testimonials. It's unbelievable. I just want to, since we had Blaze talk about the full body scan, I want you to touch on those for a moment and talk about everything that virtual imaging can scan.
Okay.
And what you test for.
Sure. So if you come in and you do a what I call a full body scan, that's comprised of a minimum of three tests, 3 studies. One is the cardiovascular score, where you get your calcium score and you get the 5 different pathway scores and your demographic score. The head brain score report will come 3 to 5 days later after signed off by the radiology team, and that's going to look for cancer, tumors. It's going to look for aneurysms. 2 million people a year die of brain aneurysms. Millions more have them and go through their life with them, but those people, they want to know, because if you know, you can track it. And you can live with an aneurysm at a certain diameter, but if you see that aneurysm is getting bigger, then we need to do some sort of intervention. So so we're looking for aneurysms. It'll do a white matter, gray matter analysis, and that'll give us some dementia predictability. It's not going to say you've got dementia. It's not going to say you don't have it, but it's going to say, okay, you're at a higher risk for it.
I'll just be honest. I'm having it Saturday, and I'm a little nervous about the brain scan.
Nothing to be nervous about. Again, do you want to go out in the Peachtree without looking both ways?
No.
All right.
No.
And then as far as then we have the core body scan, which is a separate report. So that's going to cover your neck down to your pelvis. So in the gentleman, that's going to be thyroid down to your prostate. So it includes the lungs. It includes the pancreas, liver, all those major systems in there. In the machine, the low-dose CT machine by GE can detect something up to about a 2 millimeter size. Okay.
Okay.
So it is a very thorough screen. Think of it this way: we're going to cast a really big net over your body, and then if we see something there, then we can choose to go down a diagnostic pathway, and you can safely screen once a year. Now, the other scans we can do, again, we talked about this earlier. We can do a liver fat analysis. We can do bone mineral density studies. All females after 50 need to have a bone mineral density every 2 years. Men, if they want to get one at 50, and if they're in a safe range, they can go every 5 or 10 years to get those. And then we can also do that visceral fat analysis, which is the visceral fat and the liver fat. Those are new studies that we brought online shortly after the brain study last year. And so very, very warm reception from our membership and from the community in general about those tests and being able to get those without going through a bunch of hoops and dealing with insurance.
When you lose weight, do you lose visceral fat?
The answer is most likely, but not 100%. Okay, so
how do you get rid of it?
Well, I mean, you do give yourself the highest possibility of doing it by losing weight. But it really, diet and exercise go hand in hand. So it's not just weight loss. It's not just weight loss. The exercise.
It's that exercise word again.
You got to do it. You got to do it. There's no magic bullet.
All right. Well, I know between you and my doctor, you're going to whip me into shape.
You're good. You're doing great, Belinda. I'm really proud of you.
All right. Okay. So if I have, or a listener has high cholesterol, is that going to translate into a high calcification score?
It can oftentimes, and many times your doctor will recommend probably a statin drug if you have a high cholesterol. That's a personal decision whether you want to do that or not. High cholesterol doesn't mean you definitely have a high calcium score, but it does put you at a higher risk. In my case, I had my calcium, my cholesterol scores were in the safe range and in a low range since I was 40, but yet I had this high calcium increase in my calorie. So it's not they're not mutually exclusive. You can't have a good cholesterol score and have high calcium. You can have go the other way. Just everybody's biology is different. Some of it's just genetics.
Same thing with blood pressure.
Yeah, now blood pressure is certainly that blood pressure, high cholesterol, obesity, diabetes, smoking, poor diet, lack of exercise, high stress levels. All these are things that you have to be thinking about and worrying about in terms of increasing your odds of not having cardiovascular disease. A lot of people, and with smoking, a lot of people ask me, well, why does smoking put you at high risk? And the reason why is smoking is a vasorestrictor. Okay, so you think about it. If you've got your arterial pathway is a certain diameter, and now you've got calcium inside there, and you have your smoker, it's going to compress that pathway. So you're going to start being most likely you're going to be symptomatic sooner. You're at a much higher risk of death. So smoking, although it does a lot of other things really bad for you, but that's sort of the textbook reason why smokers are at a higher risk, because that vasorestriction that smoking causes.
Say someone gets a calcification score in the say 300s.
Yeah.
What can you do, if anything, to lower that score?
Yeah. So the only thing that's clinically proven to reduce calcium is vitamin K2. That's a fact. Now, there's a lot of other people out there that say you can do other things, and I'm not saying you can or can't, but the only thing that's been clinically proven to reduce is vitamin K2. The main thing is understanding if you do have a high calcium
Thought you were
score.
going to say exercise again.
Well, exercise is always, that's true. But the answer is if you want to, the focus is less on reducing it. Because your odds of that are not great. It's really more about stabilizing it and keeping it from growing and exponentially growing. And there's lots of ways, and all these things we talked about today can cause that calcium score to stabilize. So you want to be able to stabilize it. You want to understand where you're at and understand which direction you're going. And I'll have people that'll call me and they'll say, okay, I was at 100 5 years ago and now I'm at 400. What do you think? And it's, the real, you don't know if you had a sudden jump at the last year, but you can do some assumptions, and you want to look at a 10 to 15 year pathway. Okay, where am I going to be at this rate of increase? Where am I going to be in 5 to 10 years? And that tells you, that gives you a real back of the envelope way of saying, okay, how big is my risk?
Now, when you have a heart attack, is it that the artery has closed off or a piece of the plaque has broken off?
So I'm not a doctor, so I'm not going to answer that question. I can tell you that there's a lot of things that can cause cardiovascular events. You can have plaque break off. There's two types of plaque. There's soft plaque and hard plaque. You can have soft plaque break off. It can cause a cardiovascular event. You can have just a massive blockage that causes that. So there's a lot of different things that can cause a cardiovascular event. But again, I'm not a doctor, so I'm not going to answer that question.
And you don't play one on radio.
Don't play one on the radio.
All right. Well, we're going to take a break, come back with our final segment. You're listening to the Weekly Checkup only on 95.5 WSB.
Are you with me, Dr. Wu? Ring my friend, I said you called Dr. Robert.
And we're wrapping up another edition of the Weekly Checkup presented by Wellstar Health Solutions. Barry Petrie with Virtual Imaging. Thank you so much for joining us.
No, thank you.
This
It's always
Sunday.
a pleasure.
Yes.
I love being here with you, Belinda, and your friendship is fantastic, and we can't imagine. Well, we wouldn't have a business if it wasn't for WSB. So we're very grateful.
Listen, I'm grateful for our partnership and our friendship. Let's go over. We've got to hammer home the free heart and lung scan,
Yep.
folks. You have 7 minutes. Get dialing. 770-678-SCAN, 770-678-SCAN. I mean, I can't tell you how important this is to me. Don't make me cry again. It's
literally, to walk in and get a chest CT with us. You're looking at a $1,500 value. So take advantage of it. If you don't get someone, please leave a message. We will be calling you back. You can also go to virtualimagingatl.com and submit a form there. But if you're calling in today, we'll honor this offer. And you'll probably spend about 45 minutes or an hour with us. You'll learn all about all the other scans we have. You'll learn about our membership options, and we really want to invest in your health care.
Absolutely. And it's vitally important that you take ownership of your health care. No one's going to care more about you than you. Please make yourself a priority. This is Heart Health Month, and that's why we're here today. Free heart and lung scan, 770-678-SCAN. And Barry has said every 33 seconds, someone is having a heart attack.
Yep.
I don't want that
Now,
to be...
someone's passing away every 34 seconds. Yeah.
Even worse.
Yep.
I don't want that to be anyone in the sound of my voice or anyone of a loved one that is within the sound of my voice. So please, 770-678-SCAN, free heart and lung. And if you so choose, you can sign up to have the membership, which I'm going this Saturday to have the full body scan, and I'll report back the next time that
Yep.
we're together.
Oh, you know what? That would be fun. Let's do the reveal.
I'll do the reveal.
Yeah,
I'll
we'll do that.
report everything that's wrong with me.
No. No, but I think that would be fun.
Yes.
We'll bring the reports in, and we'll if you're comfortable doing it,
Oh,
we'll go
absolutely.
through, we'll go through
I'm
the
an open
report.
book. If you don't read me
Yeah.
fast enough, I'm an audio book.
So thank you, and I appreciate your warmth, and I appreciate you sharing your emotions with us today, and it really, you almost had me crying. So
Well, my daddy was my person.
Yep.
And everybody's got one of those, and my daddy was mine. And so you don't want to lose yours when it can be prevented.
Yep.
You want them around as long as possible. So
and you want to give them that health span.
yes,
That health
and
span.
so let's call everybody that you care about. Give them this number. 770-678-SCAN. That's 770-678-SCAN for a free heart and lung. Barry Petrie with Virtual Imaging. Thank you so much for joining us on the Weekly Checkup.
No, thank you. I'm really grateful.
And I'm going home to finish the Daytona 500 with my two boys home from college. So thanks to them for coming home from college to be with dear old mom this weekend. So I'm on my way, boys. Thanks for listening. Be with you next week. You're listening to the Weekly Checkup. Be well.